Hi, I'm Dr. Twaseem and welcome to my Derm-classes. So today is lecture 3 of 4 of the etymology series, which is basically about confounding. Identifying a confounder is very important while doing your own research study or while interpreting other articles. So you need to identify a confounder as well as address the confounder. So if you're interpreting a research article, you need to see if they have properly addressed the sources of confounder. Now why? Because it actually determines the quality of the research, which means the validity of the results that you have depends if you have properly addressed the confounder or not. So let's dive into it. I have been trained from Harvard Medical School on medical research, so I hope I'll be able to share some insights with you. So let's get started. So let's imagine a study where I am identifying the association between smoking and coronary heart disease. And as I do the study, I am actually trying to identify smokers and non-smokers and the incidence of coronary heart disease and absence of coronary heart disease. But as I do the study, what I identify is that I can see more people among the smokers are elderly individuals. Can age be associated with coronary heart disease? Yes, because as the age advances, there is more chance for atherosclerosis and there is more chance for coronary heart disease. And it's also seen that, as you can imagine, more elderly people tends to be smokers than the younger individuals. So this is a case where age can be a confounder while you interpret the study of smoking and coronary heart disease. So any factors that are distributed unequally among the two groups and that can predict the outcome. So in this case, age is something that can predict coronary heart disease, and in our study where we determine the association of smoking and coronary heart disease, we have more elderly individuals among smokers. So now a factor that predicts the outcome is unequally distributed in the two groups. This is what we call as confounding. So in this case, what happens is that in those two groups, the smokers and non-smokers, they are not good proxy because the age distribution of these two groups are different. So this is where a confounder needs to be addressed. So it actually causes mixing of effects in the sense, in the study where I am determining the association between smoking and coronary heart disease, I am not just getting the effect of smoking on coronary heart disease, but the effect of age as well, because elderly individuals tend to be more smokers. So what I get in such a study would be crude measure. If I am not addressing for the age in that particular study, the result that I am getting would be a crude measure. So which means that is not purely the effect of smoking on the coronary heart disease, that is the exposure on the outcome. There is also another factor that determines the outcome, which has resulted in the result or the association that you are seeing. So now how to control for a confounder? A confounder need to be controlled during the design of the study as well as the analysis of the study. Now, let me give an example of confounding by indication. For example, imagine that you are set out to see for the adverse effect of a particular drug, and then you are randomly taking people who take the drug and they do not take the drug. If you can see, the difference between these two groups is not just merely if they are taking drug or not. If they are taking drug, probably they have a disease to take that drug, and the other people probably don't have the disease, or it might be that the severity of disease is different in these two groups, which means these two groups are not just different in terms of the exposure, which is the drug, they probably have a confounding factor, which is actually unequally distributed between the two groups. So this is what is meant by confounding by indication. So these are the examples for confounding. So now let's see the properties of the confounder. There are three properties for a confounder. The first one is there should be an independent risk factor. In the sense, for example, in the example that we have discussed already, age is an independent risk factor for coronary heart disease. Even if the patient doesn't smoke, if the patient is elderly, it is likely that they might have more chance for coronary heart disease. So it should be an independent risk factor. The second one is it should be associated with the exposure. In the sense, again, in the example already discussed, it's likely that there are more smokers among elderly individuals or in the age population than the younger population. So in the sense, the confounder is associated with the exposure. And the third one is that it should not be an effect of an exposure. For example, age is not an effect of smoking, right? Just because the patient smokes doesn't mean the patient will have more age. So it should not be an effect of the exposure. So I'll show you this in a diagram where these three features becomes much more clearer for you in the further slides. So these are the main characters to be described as a confounder. Now, your key work either as an investigator or as a person who is interpreting a research article is to assess the confounder and to see how they have controlled for the confounder. Or if you're doing the study, you have to address for the confounder in the analysis and in the design of the study. So what is DAG? This is called as direct acyclic graphs. And this is one of the methods to identify a confounder. And the second thing is you might have a prior knowledge. For example, in the case we discussed, we already know that more aged individuals have a higher chance for coronary heart disease. So that is something that you know. So you have a prior knowledge. Or you will have to look at the data. Once you see your data, you might find some of the confounding factors. So these are the different ways by which you can assess the confounder. So let's take a look at the direct acyclic graphs. As in the example discussed, age is a confounder, and you can see the arrows where age is associated with the coronary heart disease and age is also associated with the smoking. And as you know, smoking also results in coronary heart disease. And direct means there is a direct association. Acyclic means it is not cyclical, right? The arrows doesn't go in cycles. So that is acyclic. And then it's a graph. So this is something that you can use in order to determine if something is a confounder or not. So if the graph results in a cyclic graph, then it's not a confounder. So as we mentioned, age is not an effect of smoking. So that is where the acyclic thing becomes really important. Now let's take a look at the data. So in the example that we have discussed before, let's put some numbers and see how being a confounder affect the numbers. So imagine that this is a 2x2 table of smoking and coronary heart disease, and we actually want to identify if age is a confounder. So what we need to do is that first we need to stratify the two tables, the single table that we saw based on age. For example, you do one table of younger individuals and then you do one table of older individuals. And then let's have a look at the numbers. So the odds ratio, so I'm not doing the calculation. If you want, you can do, but the numbers that you get is what you see on the slide. So the odds in the younger group is at 0.1, and the odds that you get in the older population is 0.2, and that too among the non-smokers. So which indicates the age itself actually increases the chance for coronary heart disease. So there is a risk among elderly individuals. So this shows that there is an effect for age on coronary heart disease. So as you can see in this direct acyclic graph, now you have the ticked, actually it's not an X, it's actually you have ticked the association between the age and the coronary heart disease. Now we need to know if there is an association between age and smoking. So what we do is we take these two groups of smokers and non-smokers, and then you see for the age in these two groups. And what you can find is that there is more number of people or elderly people among the smokers. So then you actually tick off the second arrow as well, which is age and smoking. So this is how you actually identify a confounder, by using this direct acyclic graph. So now let's see how this actually affects the relative risk. So if you do a crude analysis where you actually don't stratify with age, the association that you get would be 2, or the risk ratio that you get would be 2. And if you stratify analysis like the young and the old people, the relative risk that you actually get is 1.5, so which is not 2. So, and then the adjusted would be 1.5. So which means if you're not addressing the confounder, the crude relative risk that you get is different from the adjusted one. So if there is a confounder, you actually need to adjust for that confounder and look for the relative risk. So this is the importance of identify a confounder and then addressing that in the analysis. Now, what you can do in the design in order to address for the confounder. So one is randomization, so which is why the randomized controlled trials are considered to be one of the highest among the hierarchies in terms of evidence. So this is because randomization is a procedure where you randomly select your subjects. So once you randomly select your subjects, what's seen is that because of this randomization, the confounders gets balanced in the two groups, like the cases and controls. When you check for example, if it's age, if it's alcoholism, anything that you see seems to be balanced in these two groups if you do a randomization. And this happens not just for the non-confounders, but it seems that it also happens for the unknown confounders. So this is where the randomization is very important to control for confounders. And the next one is restriction. For example, if you're having age as a factor of confounder, then you're restricting the population into younger individuals, or then you are restricting the population into older individuals of your case study. And then there is also matching, where you just match based on that confounder. For example, if age is your confounder, you match the cases and controls on age. So this is the three measures that you can take for controlling a confounder in the design. Now let's see how to control in the analysis. So one thing that we have already seen is stratification, where you need to stratify based on the confounder and then you put them back together and see for the adjusted relative risk. And the next thing that you can do is the regression modeling, so which is basically a statistical method. And the two of the methods that comes under this is outcome model and propensity score matching. So when you read the articles, when you see in the statistics that they have done regression modeling, outcome model, propensity score matching, which means they have actually addressed for the confounder. So mental Hansel estimation is type of a method that's again used for stratified analysis. I'm not going into the details, but if you see this, which means they have taken into consideration the confounder and they have done a stratified analysis. Now let's consider a case of incident rate ratio. So if you consider a case where the sex and mortality among patients with trigeminal neuralgia is calculated, what you can see is that the crude incident rate ratio is 1.1. So now imagine that we are stratifying this based on age, like less than 65 and more than 65. And here what you can see is that again, when it comes to adjusted one, it is 1.5. It's actually different from the crude rate ratio. So it's very important to see for the confounder and do an adjusted analysis. Now, this is an example of a dermatology study where topical tafasitinib used in atopic dermatitis is studied. So I just put this so that you can see in the methodology part they have addressed for the confounder using mental Hansel. So this is the importance of knowing what are the different strategies that you can use to identify and address a confounder. Now, so stratification is a very simple and intuitive method, but the problem is it cannot be used when there is many confounders. So that is where the regression model comes in. So this is actually an overall view about what a confounder is, what are the different methods that you can use for addressing the confounding in both the design and the analysis. And these are my references. And these are mostly from the lecture which I have been taught. So I hope that I've been able to give you some insights about this topic.